is Amanda Heather. I'm a social worker with Salem Health's Palliative Care Department, and I am so honored to be a part of this important video. My goal is to help you start the conversation with your medical providers about what we call code status, or how your care team should respond if your heart stops or you stop breathing unexpectedly while in our care. After you watch this video, I strongly encourage you to talk with your loved ones and your care team, so together we can help you clarify what is most important to you. From my work in palliative care, patients and families tell me these discussions can be difficult. We would like to applaud you for making this effort and taking the time to think ahead about what you would want if you were to get very sick. Let me introduce our two doctors who will explain your options. Dr. Fufalo, one of our hospitalists, and Dr. Peterson from our emergency department.
If you were to get very sick to the point your heart and breathing stop, we have 3 different treatment pathways: full code, do not resuscitate, abbreviated as DNR, and do not resuscitate, do not intubate, abbreviated as DNR, DNI. I'll explain full code.
With full code status, your medical team will attempt all life-saving treatments appropriate for you. If you become very sick to the point where your heart and breathing stop, your medical team will try to bring you back from death. This can include chest compressions, electric shocks to the heart, intravenous medications, and inserting a breathing tube down your throat into your lungs, referred to as intubation.
These treatments are to restart your heart and lungs, and if successful, allow time for your providers to treat what caused the heart and breathing to stop in the first place. If we are able to restart your heart and lungs, you will most likely need short-term life support in the intensive care unit, or the ICU. Success rates and outcomes for this type of resuscitation can vary, so we encourage you to talk about your medical condition with your medical provider.
The second code status is do not resuscitate, or DNR. This means that if your heart were to stop and you were to stop breathing suddenly, we would allow natural death to occur. With DNR, your care team will still provide all treatments, such as a breathing tube and a breathing machine, if it becomes necessary, up until the point you die. If your condition worsens, even while you are on life support, to the point your heart stops, our team will allow natural death to happen by keeping you comfortable and will not attempt to restart your heart. We find that patients who choose this often tell us that comfort and dignity are the most important qualities at the end of their life. We encourage you to have this discussion with your provider so that you can learn more about how this process happens and how you can make these important decisions together. The third code status is do not resuscitate, do not intubate, or DNR, DNI. This code is similar to DNR, but with a selection to not use breathing tubes or breathing machines. Like DNR code status, your care team will continue to provide treatments until the time your heart stops. However, in DNR, DNI code status, your care team will not use a breathing tube or a breathing machine under any circumstance. When your heart or your lungs stop working, your care team will focus on keeping you comfortable at the end of your life. Patients often choose DNR, DNI when they want to focus on comfort and dignity and find that attempts to restart their heart or be on breathing machines are not what they want.
Right now, you may be watching this video as you prepare for a stay in the hospital, or maybe you're in your doctor's office preparing for a surgery or procedure. As part of our obligation to providing you with the best care, we hope to talk to every patient who stays with us about their code status. Before your hospital stay, the medical provider in charge of your care should discuss your options and what is most appropriate for your care. Any decision you make today will be part of an ongoing conversation during your hospital stay. If you have any questions or concerns, your nurses or providers are always available to talk to you about your code status. Once you've made your decision, we will record it in your medical chart so your entire care team will know about your healthcare preferences. If you've chosen DNR or DNR, DNI, you will receive a bracelet that looks like this.
We hope this information helps your medical providers to get an even deeper understanding of how we'll provide you with the best care every step of the way. Another way that you can share your care wishes with your family and your medical providers is through an advance directive. These documents allow you to pick the person you want making your medical decisions if you become unable to do so, and also states your wishes about what you would want for end-of-life treatment. The form is available here on our website. It's also in most clinics and hospital units on our campus. Just ask for help. We're here to help you complete the form free of charge. Thanks for watching this video today. Here at Salem Health, we want to provide you with options for your care and the information you need so you can make the best decisions about your health. I know these can be difficult conversations, and we want to know what is most important to you. Again, I encourage you to talk through these decisions with your care providers and your care team members and those close to you. Ask questions about how these choices fit in your life and your medical condition. Here at Salem Health, we want to know what matters most to you so we can respect your wishes and provide you with the best care possible.